Good afternoon. My name is Crystal Rocket. I am currently enrolled in the RN program at the Mississippi University for Women. And today I want to present to you all a PowerPoint presentation on opioid crisis. Thank you all for coming. Some of my current co-workers and former co-workers, we have some nurses, some techs, and a respiratory therapist. Now let's get started. Opioid crisis. The objectives from this PowerPoint. By the end of this presentation, the learner will be able to identify some statistics regarding the national opioid crisis, identify the impact the national opioid crisis has had on the healthcare industry, identify the signs and symptoms of opioid abuse in lay people and co-workers, identify ways that organization or community can help combat this threat to health, identify ways healthcare providers are using technology to care for patients with opioid abuse problems, and identify ways in which you can make a difference. The national opioid crisis. It's an overabundance or misuse and addiction to opioids, including prescription pain relievers, heroin, and others, including synthetic opioids such as fentanyl. It is a national threat that is affecting our public health as well as our social economic welfare. From 1999 to 2017, more than 700,000 people have died from drug overdose. In 1980, acute pain was so frequently treated with opioids that propoxyphene was the second most dispensed drug in the United States. This national opioid crisis is also affecting people with mental health issues as well. When mental health issues and chronic pain include a pharmacology treatment plan, there is a risk of drug dependency and or an adverse drug reaction, which creates a volatile environment for abuse and illegal use. When medications such as opioids like oxycodone or benzodiazepines like Xanax are properly prescribed and used, the chance for addiction is relatively low, although it still can occur. Let's talk about the impact this is having on the healthcare system. Only about 10% of adults with substance abuse disorders receive any type of specialty treatment due to insurance coverage limits and shortages of addiction treatment by providers and facilities. Increase in opioid-related inpatient hospital stays and emergency department visits. Medicaid spending for addiction treatment increased by 136% from $400 million in 2011 to $930 million in 2016. Some non-fatal cases of addiction contribute to lost workplace productivity resulting from medically related absenteeism and disability costs. These strains have caused opioid addiction on public health, healthcare, and emergency providers are very significant. Opioid abuse has also spiked among adolescents, with related deaths from heroin and other opioids rising about 20% from 2014 to 2015 for adolescent age. Opioid misuses have also contributed to a resurgence in transmission of HIV and hepatitis C among injecting drug users sharing contaminated needles. Societal costs stemming from opioid misuse are enormous. By one estimate, approximately $92 billion in 2016 alone was spent on healthcare, labor, and law enforcement efforts in response to the epidemic. Nearly a quarter of the total economic burden has been borne by public sector health programs. This here is just a chart of the different opioid epidemic by the numbers, 2016 and 2017 data. There have been over 130 plus deaths every day of people related to opioid overdose. 11.4 million people misuse prescription opioids. 42,249 people have died from overdosing on opioids. 81,000 people use heroin for the first time, and 15,469 opioid deaths contributed to heroin alone. Now let's talk about how technology can help care for these patients. Different digital devices and little gadgets that they're using nowadays can help doctors treat these patients at a closer range no matter what. You can create a digital profile for your patient, which allows providers to work with patients no matter where they are, anytime or any place. It allows providers to see what the patient actually goes through on a daily basis. You can send digital messages of support to your patients from the providers, family members, or peer support members. They also have a prescription drug monitoring program known as the PDMP, which is an electronic database that tracks controlled substance prescriptions. Now let's talk about the signs and symptoms of opioid abuse in the lay person and healthcare provider. In lay people, you will see cravings or sweating, euphoria or general discontent in their mood, constricted pupils, chronic constipation, nausea and vomiting, shallow breathing, or slurred speech. In healthcare providers, you will see work absenteeism, frequent breaks at work, missing work, confusion or memory loss, and difficulty concentrating on recalling ideas, inappropriate prescriptions for large narcotic doses, heavy wastage of drugs. Now, let's talk about how ways that the community and you can help combat this crisis. The CDC provides you with a lot of good information that you can go on and look at more in detail about the national opioid crisis. The months of August and September, they highlight the awareness in fighting the crisis. We all need to try to continue to support our states in scaling up with prevention efforts and put the data that has been collected and the resources that have been provided to continue pushing the prevention of this crisis forward. Now, how you can make a difference. First, if you see someone out there that you start seeing some of these signs and symptoms in, let's not try to dismiss these patients from care because they need our care. Early recognition and intervention of these signs and these patients or co-workers who abuse drugs can help make a difference. Encourage any family, friends, or co-workers who have a problem to admit that they have a problem and seek treatment right away. You can also provide them with information to local treatment facilities. And be supportive. Don't be non-judgmental. Don't be judgmental. That's the end of my PowerPoint presentation. Any questions?